Welcome to today's update, where we're going to do a bit of a global roundup today, and I hope you've had the chance to review the therapeutics and more science-based videos of the past couple of days, because it's this science and this analysis of the papers, the publications about COVID-19 that really makes sense of everything else, because we have to base what we're doing on the science and on the evidence. Now, globally, let's have a look at things today. Globally, the number of cases, of course, is continuing well over 15 million now, essentially, isn't it? 617,000 deaths officially in the global situation. Now, starting off with the US first of all, and there's some fascinating things going on, actually, and do hang on for what Mike Pompeo has been saying lately. Anyway, the US cases are basically getting up to 4 million now. But the director for the Centre of Disease Control, Dr. Robert Redfield, has said the real cases are probably about 10 times that. This is exactly what he said. Our best estimates right now is that for every case that's reported, there are actually 10 other infections. So he's in the know, that's what he's saying, 10 times more. So the official number of laboratory diagnosed cases in the United States is getting on for 3 million, getting on for 4 million. That should be this is actually an updated number. That should be an 8. Sorry about that. The number keeps changing every time you go to the website, obviously on the CDC. So nearly 4 million cases officially diagnosed. The real number is nearer 40 million cases. 39 million cases actually infected in the United States. So getting on for 40 million cases. Now, this brings out some really interesting points. Now, we've probably got 40 million people in the United States who have been exposed to the virus and are currently infected or have been infected. But of course, there's 328 million people in the United States, so that leaves about 290 million people still potentially vulnerable from infection. Now, we think herd immunity has reached at around about 70%. So that means that there's potentially another 200 million people in the United States could still be infected. So realistically, what we've got in the United States is 40 million people have been infected so far. 200 million people still could be infected. That means we're still at the start of this pandemic, I'm afraid. We're not a quarter of a way into it in terms of number of people who've been infected. As of now, we've got a ways to go. Now, if the number of deaths is 140,000 and the number of cases is just under 4 million, that gives us a death rate of 3.68%, a case fatality rate of 3.68%. But if the real number of people infected is 40 million, or just under 40 million, and the deaths are 140,000, that gives us a case fatality rate of under 0.4%. Now, there's always a lag, of course, in these things, because deaths take a time to come through. But what this is looking at in the United States, it's looking like the death rate is probably going to be about 0.4 to 0.5. based on the current information that we have because of the lag. So with the lag effect, it's probably going to go up a bit. And the other reason I'm putting that 0.5 figure there is what I fear is that because there's such exponential growth in the United States at the moment, I fear that hospital facilities are going to be greatly challenged. Let's hope I'm being pessimistic there, and let's hope that the actual case fatality rate is 0.368, which is probably about the lowest we can expect, unless the director of the Centre of Disease Control has greatly underestimated the amount of people that are infected in his country. So that's kind of where we're at with the overall figures. President Trump, it will probably unfortunately get worse before it gets better. And we've just said that, 40 million infected so far, and perhaps another 200 million potentially still could be infected. Something I don't like saying about things, but that's the way it is. So this is direct quotes from President Trump. Now, before we go on, let's just look at some further evidence that agrees with what the president and I guess myself are saying. And this is the lifetime R figures. The lifetime RT figures for different states. So we see that we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 states where the number of cases are falling, where the R naught or the R in real time is below 1. Quick calculation means that that's 38 states where the number of cases are increasing. Although technically they're South Carolina. That surprises me. Florida, it's saying the R0's 1. Hopefully the cases are down in Florida. It wasn't my understanding, but that's what this website's saying. But at the top we've got Alaska. Alaska's increased dramatically. Montana, Kentucky. Go on this yourself. It's absolutely fascinating. I'm amazed that Florida's so low. That's very pleasing that Florida's so low as that. California down as well, and Texas, according to these data. So that's encouraging, because these were the populated states where there was a lot of a high number of cases. So if that's getting under control there, that's remarkably encouraging. Do look at that for yourself. I've also put the link into the CDC website to look at up-to-date lifetime information. Especially on the CDC website, it goes by state, which is very useful if you want to look up your area. Now, going on with what the President Trump has said, we're asking everybody that when you are not able to socially distance, wear a mask, get a mask. Right, get a mask. So I'm really pleased to see this, because this, to my mind, which is maybe somewhat simplistic about this, but this takes the political divide out of mask wearing. This is no longer a political issue. So the president, who's obviously a Republican, is saying wear a mask. Democrats have been saying wear a mask for ages. Wearing a mask is no longer a political statement. It is a statement that you are concerned about the health of the people around about you. So there is now no political reason in the United States not to wear a mask. Pity it's taken so long, but there is now no reason not to wear a mask, and everyone should do so. Whether you like it or not, they have an impact. So this is President Trump saying masks have an impact. They have an effect, and we need everything we can get. Well, that's absolutely true, isn't it? We need all the help we can get. So myself and the president agree 100% on that. Getting used to masks. So he says he's getting used to masks and would wear one himself in groups or when on in an elevator, which we would call a lift in this country. So good. President Trump said he'll use it gladly, talking about masks. Excellent. Anything that potentially can help is a good thing. And then he went on to reiterate hand hygiene and other basic measures, which was remarkably reassuring. So the president 100% on board with that message now. It's no longer a political issue. No excuse not to do it. Let's get those R figures down. The president urged young Americans to avoid crowded bars. I've seen a lot of outbreaks that have been bar related. Now, Mike Pompeo, Secretary of State, of course, and this is reported in the Telegraph this morning, and I think it's in quite a few other news outlets, and it's quite alarming, really. It's quite incredible. Mike Pompeo is saying that Dr. Tedros, the head of the World Health Organization, of course, has struck a deal with China that helped him secure election. Mike Pompeo suggested that the World Health Organization was a political rather than a science-based organization. Could there be stronger condemnation? Really? that had failed to deal with the pandemic. Dr. Tedros, according to Mike Pompeo, was bought by the Chinese government. Mike Pompeo said, I can't say more, but I can tell you, I'm saying this on firm intelligence foundation, a deal was made. Now, Mike Pompeo has got access to the full resources of the United States intelligence gathering apparatus. Mike Pompeo is a well-informed man. Whether you like him politically or not is irrelevant. He's a highly well-informed man. And if this is what he says, then that's what he says. I, for one, would accept it. I don't believe Mike Pompeo is lying through his teeth about this. If he says he's got the intelligence, then I think he's probably got the intelligence. Draw your own conclusions. There was a deal-making election, and when push came to shove, you get dead Britons, because he was speaking in the UK, because of the deal that was made. Now, the World Health Organization, in my view, has made a series of appalling decisions. The very worst one it made, can't remember quite when it was now, I'll look up the original video, but when the epidemic, as it was then, before it was a pandemic, was in China, the World Health Organization was saying there's no need to cancel flights from China. Unbelievable. Now, Dr. Tedros was elected to be the head of the World Health Organization in 2017. And running up against him was another doctor called David Nabarro. But there is a difference, because David Nabarro is a lifelong medical doctor. And of course, Dr. Tedros is not a medical doctor. He's a PhD. He's not a medical doctor. He hasn't served his apprenticeship giving out medicines and giving injections and taking bloods and all the things that doctors do. So we've got Dr. Tedros, who's not a medical doctor, he's an academic. I believe he was Ethiopian Minister for Health, so he's got a background in politics. And then we've got Dr. David Nabarro, who ran up against him in 2017. And Dr. Nabarro has said it's imperative that all countries work together to fight the massive global catastrophe of COVID-19. So this is what Dr. Nabarro is saying now, to try and bring people together, because it doesn't appear that he wants to debate at this time. Now, if you I put the link there. Look at the CV of Dr. David Nabarro. It's impressive. He's had experience in over 50 countries over 40 years, running various programs and taking various initiatives. My wife was actually taught by David Nabarro when she herself was a student at the Hospital for Tropical Diseases in London. So he's got a long record of academia and teaching and leadership. And when you read his CV on those links there, you think he's a perfect candidate for the World Health Organization. And to tell you the truth, it does seem strange to me that rather than giving the job to David Nabarro, the job was given to someone with a research and a politics background rather than a career medical doctor. Does seem like a very strange decision. So personally, I would like to see Dr. Nabarro replace Dr. Tedros immediately. That's my personal opinion. Now, moving on to India. Now, the cases in India, officially it's 1.2 million cases officially, 28,000 deaths. But the National Centre for Disease Control, so they've got a CDC in India as well. So the Indian CDC has tested 21,000 people selected randomly across the Delhi area. Now, this is a random sample. It's a large sample. That's a good sample. And the Indian researchers know all about random testing. I'm sure they'll have done a very good job of that. And they found out 23.48% had COVID-19 antibodies, allowing for false positives. That means that in the greater Delhi area, 22.86 people had COVID-19 antibodies. Therefore, most cases have gone undetected. New Delhi, the population is 26 million in 2016. quick sum tells you that that means that in the New Delhi area there is almost, very probably, almost certainly 6 million infections. Making a complete mockery, of course, of the figure for all of India. It's way, way higher than that. So in the New Delhi area, looks like there's 6 million people have been infected. Now, we've looked at the death rate in the United States, which we expect to be 0.4 to say 0.5. But I expect it to be higher in India because of difficulty for poor people accessing healthcare. I expect it to be 1% in India. Let's hope I'm wrong. I really hope I'm wrong, but that's what I'm expecting. So that would give us 59,000 deaths as a result of this 5.9 million people that are infected. So a lot more deaths to come through the pipeline in the next few weeks in the New Delhi area, unfortunately. And if we take the whole of the New Delhi population, which of course remember was 26 million, whole population number 26 million, 70% of that would be 18.2 million, and that would give us a 1% death rate of 182,000 people that could die in the New Delhi area in the next few months. Let's hope I'm wrong. Now, this is some huge Hindu festival where people traipse off to the Himalayas and things. The thing about these Hindu festivals is you get sometimes literally 1 million or more people, I think, all crammed together. So glad to see that's been cancelled. Now, Australia. Victoria had another 484 cases, a daily record, unfortunately. Mandatory for everyone in the state to wear masks when they leave their homes. So we've got a record increase in number of cases in the Melbourne area, basically. But this doesn't mean I'm particularly pessimistic, because the interventions that were put into place by the authorities in Victoria, Melbourne being the capital of Victoria, in the last week or two, will start to filter through in the next week or so. So I suspect these cases will go down because of the stringent measures that have been taken by the authorities in that area. So it doesn't surprise me that they're going up now. I would expect them to level off or start going down in the next few weeks, I would hope, because the situation is being well managed. Unfortunately, I would expect the death rate to keep rising for another few weeks because of this lag effect. So I'm still optimistic about the abilities of the Australian authorities. Let's hope I'm right, and that they're able to contain this. And of course, Victoria and New South Wales are still closed off. Of course, you can't travel around Australia at the moment. Thailand, incredible, 3,261 cases, 58 deaths. Thailand are extending the emergency decree until the end of August, and this is amazing. Thailand has gone nearly 2 months without local transmission. Nearly 2 months without local transmission. That is just quite incredible. So the measures that were taken quickly, efficiently and early by the Thai authorities are really paying dividends now. Now, of course, the downside of this, with the state of emergency extended until the end of August, Thailand, so many of the poorer people in Thailand especially, are so dependent on tourism. And of course, this is stopped. So the economic consequences are going to be huge knock-on effects for especially the poor people in Thailand. But pandemic-wise, it does seem to be working. Hong Kong, 58 cases, so an extra 58 cases. 28 from unknown sources, 25 from unknown sources. So 25 by community transmission. So there is some community transmission in Hong Kong, but I would expect them to get on top of that, I would hope. People being advised to stay at home if possible. You know, it's interesting. I was just reflecting on this over the past couple of days. looking at the immunity that we've been looking at, because of course SARS-1 was more common in Hong Kong and Taiwan, and these are countries that have done very well. So maybe there was some immunity left over in Taiwan and Hong Kong from SARS-1 in 2002, 2003. Just probably another factor. But the Taiwanese especially handled it particularly well, as we heard when we talked to Craig a few weeks ago. Czech Republic, a small nation in the Central Europe. Cases are increasing at the moment. This is the highest number of active cases they've had. The pandemic has kind of bypassed them a bit so far. Let's hope it carries on doing so, but increasing cases there, just to take an example from Central Europe. Now the UK, these are the official cases. It's 10 times higher. These are the official deaths. Now, masks are going to be mandated in public confined spaces, in shops, from the 24th, a couple of days' time. But of course, we should be wearing masks now, every time we go into an indoor public space. And the thing that's slightly disappointed me about the UK is people just don't seem to get the concept of ventilation, diluting the viral load. So you go into shops and confined areas and the doors are shut and the windows are shut, and it's summertime. Why is it that we just don't seem to get this concept of ventilation? So we need mask wearing and ventilation, face covering and ventilation. And we just don't seem to be getting it. So my message to the Western world is, in summertime at least, when you can, or when it's not too hot or cold outside, open all the doors, open all the windows, get some air blowing through your shops, reduce viral load, reduce transmission. And this is substantiated by work from the University of Nebraska. Now, I've just put this in. Really, these are things we've known about for a long time, but the research is starting to come through now that substantiates it. COVID-19 can spread through normal speaking and breathing, travelling further than 2 metres, as we've said for a long time. Collected air samples from the rooms of 5 COVID-19 patients. So they collected air samples from the rooms of people that were sick with COVID-19. And again, we've been talking about this since February. The sick room is a highly contaminated room. If someone is sick and they have COVID-19, then everything in that room is contaminated. We need to open the windows, close the door to the rest of the house, consider the air to be contaminated in that room. And this also applies for some hours after someone has died in a room with COVID-19 as well. So quite serious implications for people that are dealing with the deceased. I've had several local conversations about that, and it appears to be successful so far. But it's very important to remember that all the bedclothes, the surfaces in the sick room will all be contaminated. And now, as we've suspected for a long time, but this is actually now being confirmed through taking actual air samples, so proper empirical evidence that the microdroplets are hanging in the air for several hours. Patients talking, producing microdroplets can remain in the air for a number of hours. Do we have microdroplet transmission? Is it airborne? Yes. This evidence would suggest that it is. Now, this is a bit disappointing. Nobel Prize banquet cancelled in Sweden in December. 1,300 guests had planned to go, so I guess I just have to dig my allotment in December instead.